Hi, my name is Megan Taylor, and this is going to be my Foley catheter insertion competency video. So, before I would enter the room, it's always important to pump some hand sanitizer and perform hand hygiene. Before you enter the room, it's always a good idea to know who your patient is and what you're going to be doing. So you go over the MAR, you go over your orders, perform hand hygiene, and then enter the room. As you're entering the room, you say, "Hi, my name is Megan. I'm going to be your nurse today, inserting your Foley. Can you please tell me your name and date of birth?" So that way you can identify your patient. So they tell me what their name and date of birth is. I compare that to the MAR and compare that back to my order, so I know that I'm doing the procedure on the right patient at the right time. You ask your patient if they have any allergies to iodine, betadine, or shellfish, as well as latex, to make sure that you have the proper kit that you're using. You want to explain to the patient what exactly you're going to be doing. So I would explain that I'm going to insert a Foley catheter, but before we do that, we're going to do pericare. So I would help my patient in the dorsal recumbent position, the frog position. I would move the bed to a safe working height, provide for privacy, put on a clean pair of exam gloves after performing hand hygiene again, grab some bath wipes, and just perform a little bit of pericare before you insert your Foley. So once the pericare is done, you want to ask your patient if they have any other questions before you start. She's all good. She doesn't have any questions. So I'm going to move over here to my sterile kit. In an ideal world, in hospital, you would have a bedside table, but we're just going to work with the desk right now. That's all fine. So you want to perform hand hygiene again. Open up your sterile kit. Around the sterile kit, you have a 1-inch border, a sterile 1-inch border. So you open up your kit just like so. We have a sterile drape that's going to go underneath the patient, so you can grab it from the middle, let it fall open. 1-inch border, just like with the other drape. The shiny side of the drape is the side that goes down on the bed. You ask your patient if they can lift their bottom so you can more easily slide the drape under, and we are all set there. From here, I can grab my gloves. I'm gonna make sure that this doesn't blow over. There we go. Okay. So I can grab the outside of this glove and work them on my hand. There we go. They don't have to be perfect right off the bat. You can fix them once you get your other glove on. Now I can go underneath here and slip it on. There we go. And now it's sterile on sterile, so I can fix my gloves. Sterile and sterile. I can fix my gloves. And we're all set. Grab my corner, drop. From here, now, I can set up my tray. I can separate top from the bottom here. Place that on the sterile field. I have the fan on, so everything's going to be blowing just a little bit. So I have lube. You're going to open up your lube, squirt your lube in the corner of your box, making sure to lubricate 1 inch to 2 inches of the catheter. You can drop the lube in the trash. I'm going to open up my iodine swabs. They're open. Place them in the corner of my kit because they're going to go with me. And then you also can attach your syringe. So we're all good here. Whoops. I can move my box over here to my patient. So you want to visualize your field. You want to spread the patient's labias. When you swab, you're going to swab the farthest labia first, the closest labia, and then down the middle. Before you do that, you want to give up a sterile hand to be able to hold the patient open. So I'm going to give up my right hand here, and I'm going to spread open my patient's labias, and then I'm going to grab my iodine. There we go. Okay, so I have my iodine here. I'm going to clean the farthest labia, trash. And then I only have one in that kit because I practiced with the other ones. But you clean the farthest labia, the closest labia, and then you go down the middle, discarding them each time. And I'm only working with my left hand now because I gave up my right hand. From here now, we are ready to insert the catheter. And throughout this entire process, you're talking to the patient, making sure that they're comfortable, you're explaining what you're doing, because they're in a vulnerable position and you want to make sure that they're doing okay. So from here now, I can grab the tip of my catheter I'm going to pretend that we threw these away so it's not in the way anymore. We can grab our catheter here, instruct the patient to take a nice deep breath. We're going to visualize our field, and then we're going to slowly insert the catheter until we see urine. Once we see urine, we're going to insert another 2 to 3 inches. So I'm still pushing, and I'm still pushing after I see urine, another 2 to 3 inches. Once we're finished here, we're going to hold the tip of the catheter with my left hand. I'm going to take my right hand that's not sterile and inflate my balloon. Inflate, 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 inflate. All right, so it's not going to go all the way because this kit's been used a lot. But once we insert all 10 cc's of the syringe, I can undo it, throw it away in the trash can, pull back to make sure that you get resistance. When you feel resistance, you know the balloon is completely inflated, and you are all set to go. So from here, it's inflated. The catheter isn't going to go anywhere. You can grab your bag out of the kit. Whoops. It's going to stay in my patient, hypothetically. You can grab the bag out of the kit, secure it with a securing device, making a J shape on the patient's leg. You're going to hang the bag at the bottom of the bed. You're then going to take off your sterile gloves, perform more pericare, lower the bed to a safe position, make sure that the patient is comfortable, and ask if they have any more questions. So that is how to insert a Foley. To take out the Foley, we walk in again, introduce ourselves, say, "Hi, I'm Megan. I'm going to be the nurse taking out your Foley today." You ask what your patient's name and date of birth is, compare that back to the orders, and the MAR. Explain to the patient that you're going to be taking out the Foley. To do this, it's not a sterile procedure, so I don't need my exam gloves anymore, or my sterile gloves. You just perform hand hygiene, put on a clean pair of exam gloves, and you need an empty 10 milliliter syringe. And normally I grab like a bath wipe or something to hold over top, so that way when I'm pulling out the catheter, if anything comes out like fluid, it'll be there to grab it. So before you take out the catheter, you want to make sure that you empty the bag. My patient just fell. But my patient in the real world wouldn't fall because I would make sure that the bed is at a safe height and everything would be fine. They wouldn't fall out because I would have the right safety measures. But anyway, we have our patient. I have clean exam gloves on. The Foley is in. I'm going to explain that I'm going to attach the syringe wait for the, attach the syringe and let the water come out itself, not to pull on the syringe because that could hurt the patient. So you're gonna deflate your balloon here. There we go. Hold a bath wipe right here over top your patient, and then instruct them to take a deep breath and then pull your Foley out. Once the Foley's out, perform more peri-care to clean the patient up. You can gather all of your dirty belongings, place them in a red bag, discard, move the bed back to a low, safe height, ask the patient if they have any more questions, instruct the patient that they need to be able to go to the bathroom between 4 or 6 hours by themselves after having the Foley removed. And then just, again, make sure that they're comfortable and ask if they need anything before you leave. And that is the end of my competency. Thank you.